Hi, I am Doctor Asim Farooq. You are watching Doctor's Orders. Today I'm going to have a quick roundup of what's going on in the last week, what we need to know about regarding coronavirus, some exciting news, so please keep watching Doctor's Orders. Some of you may have been tuning in every night on ITV1 at 9 o'clock for a spin-off show of The Chase called Beat the Chasers. It certainly is good fun, isn't it, guys? However, you will find if you tune in on Friday the 1st of May, you will find your favourite doctor, that's me, appearing on the show trying to take on and beat the Chasers. Please tune in and cheer me on as I do it for Croydon and the doctors out there. Many thanks. First of all, congratulations to the birthday boy. Not just that one. My best wishes do go out to the Prime Minister and Carrie Simons. But this one, he's a shining beacon for us all. He's still going strong at the grand old age of 100. He's raised £29 million so far. Well done, Captain Tom. Don't forget to clap for the NHS tonight as well. Last time I did highlight the BME population seems to be at much higher risk of severe illness or death from COVID-19. I mentioned some of the common risk factors such as age, blood pressure, diabetes, and also their socio-economic situation, rather than just poor genes. But a study on twins has shown there may well be a genetic element to why some people do react differently to the virus. There has been a recent call to consider taking BME healthcare workers off the front line. I don't entirely agree with this because everyone realizes that if you did that, the NHS would collapse without the BME population. My advice, however, to any BME staff members with a coexisting condition, please minimize the contact you have with patients. Try to use resources available such as remote working. Make sure you are given the correct PPE N95 masks with visor and gown. I would also like to salute another fallen Croydon colleague of mine, New Addington paramedic Ian Reynolds. Also this week the NHS has launched a campaign reminding us that the NHS is still open for business. Do not delay seeking help, especially for emergency conditions which are being missed, such as heart attack and stroke. Don't forget that in the NHS we have changed the way we are working. We are including telephone and video consultations. We've also divided areas up into COVID and non-COVID areas, hot and cold, so do not be afraid to seek help when required. And related to that, we did also receive a warning about a condition affecting children. This behaves a bit like Kawasaki's disease, where children will have unexpected inflammatory condition and a severe illness such as toxic shock syndrome. So if your child has diarrhea and vomiting with severe abdominal pain, a high temperature going on more than a few days, plus any symptoms like pain in the chest, they must seek urgent attention. It might seem complicated, but follow the same principles you would do to distinguish a child who is septic or not. These can also be found on the UK Sepsis Trust website. If we look at the Sepsis Trust website, it will tell us your child may be septic if he or she is breathing very fast, has a fit or a convulsion, looks mottled blue or pale, has a rash that does not fade when you press it, is very lethargic or difficult to wake, or feels abnormally cold to touch. Also do remember, if your child is under 5, they might have sepsis if they are not feeding, if they are vomiting repeatedly, and if they have not passed urine for 12 hours. So if you are having these symptoms, do not hesitate to ring the NHS. We are open, as I mentioned earlier. And let's not forget about the signs of sepsis for adults, and this can be easily remembered with the mnemonic sepsis. S for slurred speech stroke confusion. E for extreme shivering or muscle pain. P for passing no urine in a day. S for severe breathlessness. I, it feels like I'm going to die. S for skin is mottled or discolored. So again, if you can remember this mnemonic, remember sepsis, do not hesitate to call us.